In the event of a bleeding injury or massive hemorrhage, we must immediately approach the patient and, if we do not have protective equipment, ask them to apply pressure to the wound with their own hand. Then, we carefully position the patient in a safe, sitting position. Once the patient is safely on the ground, we apply a rolled piece of bandage or gauze directly to the wound and maintain firm pressure to prevent further blood loss. If the bandage or gauze becomes saturated, additional layers must be applied or a securing layer should be added. The patient should be instructed to keep applying pressure to the bandage or compression dressing. We begin wrapping the area around the wound firmly to ensure that the compression layer maintains adequate pressure on the injury. In cases of massive bleeding from the lower limb, we must anticipate that the hemorrhage will be more intense than in upper limb injuries. The same principle applies. The patient should keep applying pressure to the bleeding wound with their own hand. Once we have the necessary protective equipment, such as gloves and bandaging materials, we proceed with the application of a pressure dressing by placing gauze or a compression layer directly onto the wound. If the patient is cooperative, they may help hold the dressing in place while we continue wrapping it securely. It is crucial to apply sufficient pressure on the compression layer to effectively control the bleeding. If the pressure dressing continues to soak through after applying 2 additional layers, the affected limb must be elevated above heart level. If elevation does not control the bleeding, the use of a tourniquet is required. The tourniquet should be at least 5 centimeters wide, as its thickness will decrease with tightening. It must always be applied over clothing. The first loop should be wrapped loosely, and once the tourniquet adheres to itself, we begin progressively tightening it. Proper tightening is essential. And as the tourniquet is secured, its width will reduce from the initial 5 centimeters to approximately 3 centimeters. A properly applied tourniquet will effectively control massive bleeding. The correct application will be evident when the skin color of the affected limb changes to a waxy white.